Thank you for joining us for our 5th week of our point of care ultrasound course. And this week we're going to do a little bit of a review and discuss we've kind of bombarded you with information about how and why we should do the things we should do. And so today we're just going to do a quick synopsis of procedures to complete when you're scanning to improve your imaging, make it a lot more efficient and a lot less frustrating. So we will go ahead and get started. Our outcomes or objectives for today's lecture are to identify the optimal scanning positions and practices, describe changes to scanning techniques to improve your images, and utilize focus, angles of incidence, gain, time gain compensation, dynamic range, depth, and frequency to improve your sonographic images. So starting out, the first thing you want to do is all of our images are we're gonna have to select a B mode preset to begin with. So number one is we need to think about the anatomy that we're going to scan. Of course, enter our patient information into the system if we're going to be imaging a patient. And then we need to decide what transducer is going to be most effective for the particular scan that we're doing and what we're hoping to accomplish from that scan. So one of the first things you'll think about, for instance, if you're going to be doing a fast exam and you're going to be running through the patient very quickly, you notice your patient is large, you'd probably want to start with either your curvilinear or your sector transducer. Most systems will require you to select a transducer and then select a preset based off of which transducer you're using. So the same presets may not be available for all different transducers. So if you're not seeing the preset or the exam type that you want to perform, then you may have the wrong transducer selected. So when you're selecting transducer type, a couple things really matter, and that's mainly the frequency of the transducer. So we know that if we're trying to image something that has a low depth and we want really good resolution, then we might go with something like our linear probe that has a higher frequency. If we need something that is going to have more penetration and we're going to have to trade some resolution to get the penetration that we need, we're going to go with a moderate or lower range curvilinear. Now, if we need kind of the penetration from that curvilinear, but the curvilinear footprint is not going to be what we want, or maybe we want to even go a lower frequency than the curvilinear will allow, then you might consider doing your sector or vector. These are really nice, as you probably remember from previous lectures, for getting into between ribs, using low frequencies to get deep on difficult to scan patients. Your curvilinear is kind of your workhorse. That's what you're going to go to for most of your abdomens, pelvises, things like that. And as well as your deep venous structures or deep arterial structures. And then your linear is really going to be fantastic for thyroids, a carotid, maybe a breast, or a hematoma that's just under the skin. So each of these has their own purpose and their function, and when you're starting each exam, you really want to evaluate both the anatomy that you're imaging, the depth of that anatomy, your patient size, and then what presets each of these particular transducers offer. Once you have selected your preset, put your selected your transducer, selected your preset, made sure your patient's information was in if you were going to be saving images, then you can start scanning. And then step 2 after you start your scan is to optimize your image. So first thing you want to do, of course, is to find the anatomy that you are intending on evaluating. And so that could be as easy as if, going to your patient's mid-sagittal line if you're looking for the aorta, or maybe over to their, subcostal region of the right side if you're looking at their liver. And then be aware, though, that there's going to be different what we call windows for every patient. So, one patient, you might see a beautiful aorta right at their midline in the mid-sagittal plane. Another, you might actually have to move to the patient's right or to the left, or even come from a coronal view to get the image of the aorta because of overlying or obscuring bowel gas. So don't be afraid to try different windows, things like small rib spaces, scar tissue between the ribs, overlying bowel gas, scar tissue from previous surgeries, things like that can all affect how a window works on a patient, and no two patients are going to scan perfectly from the same windows. The other thing that you don't want to be afraid to do is to have your patients move, especially if you're scanning, say, the liver or even the spleen. Putting a patient into a right posterior oblique for the spleen works fantastic, as well as for the left kidney. Putting them into a left posterior oblique works well for the liver or gallbladder, and then moving them into a left lateral decubitus can also help move some of those organs out from under their ribs to give you more ease of evaluation. Another thing that we use as sonographers all the time is suspended inspiration typically. So having the patient breathe in and hold their breath often pushes anatomy out from under either ribs or bowel gas or different things. So don't be afraid to have them do that if that's possible. Then once you finally find your window that you're happy with, then you're going to want to optimize your image. So say if we are looking, well, in this case, this is not just our general B mode imaging, but say we just have our B mode imaging on, just the black and white image. I would want to make sure that I have the appropriate depth of my image. I want to go just beyond what I'm intending to see and not too much farther. If I have excessive depth, it is going to minimize the size of the anatomy I'm looking at. And sometimes we get so focused on the anatomy that we're looking at, we don't pay attention to what our depth is. And then when you adjust the depth, you see so much more clearly what you were trying to look at in the first place. So first thing you want to do is adjust your depth. Secondly, if you feel like you aren't getting the penetration that you need, and this is especially common in the liver, maybe somebody has a fatty liver or cirrhotic liver or is just a heavier patient, sometimes it's difficult to penetrate that liver from the anterior surface to the posterior surface. And so knowing your adjustments on your equipment to change the penetration of that image is going to be essential. And you may remember from previous lectures that penetration is determined by your frequency. The higher the frequency, the less the penetration, but the better the resolution, and the lower the frequency, the greater the penetration, but the worse the resolution. So you want to use the highest frequency where you're getting adequate penetration. So each of our transducers that you will have available to you, you will be able to set penetration somewhere between what's listed on the transducer. So on the side of most transducers, you'll see something like, for instance, on a curvilinear transducer, it's probably printed 2 to 5. And that would indicate that you could operate that transducer at 2 megahertz to 5 megahertz. If you have a very small, slight patient that you don't need a lot of penetration, but you want that fantastic resolution, you can go with your 5 megahertz. If you're still using that same probe, but you have a very dense liver or a thicker patient, you might need to go down to the 2 megahertz to get penetration all the way to the back of the part that you're looking at. Now, each system is going to have a slightly different approach to changing penetration or changing your frequency. Some will have a direct knob or something like that on the machine, something probably up in this region, or maybe a touch screen up here that would allow you to just simply change from 5 megahertz to 2 megahertz. GE machines are typically set up that way if you're utilizing one of those. On the other hand, there's other manufacturers that don't give you that direct approach. They'll have something called general penetration and resolution. And when you're in the general setting, you'll be scanning kind of at the middle of the two ends of megahertz. When you're in the penetration, you're going to be scanning at the lower end of those megahertz. And when you're in the resolution, you're going to be at the upper end. So some of them, like Philips, will have a more indirect selection of penetration. Okay, so now by this point, you've found a window, you have appropriate depth set, you feel like you're penetrating the organ of interest if possible. You want to make sure that you have the appropriate gain set, and the gain button is typically the most prominent button on your screen, something like probably in here or maybe somewhere down here, very prominent button. And this is where you're going to adjust the brightness of your image. So by turning this button up, you're going to make your image brighter. By turning it down, you're going to make it darker. The idea of gain is that we want to have it high enough that we are not blacking out any real information, and low enough that we're not creating artifact or information that's not there. So it's suggested by some that when you find your image, you turn your gain up what would be considered too high or too bright, and then you back it off slowly until you feel like you have gotten rid of all the artifact, but you're still maintaining all the real information. Now, with that gain, once you get it to where you are happy, so your next step is going to be to adjust the TGC. And if you remember, the TGC is the time gain compensator. And on this piece of equipment we have as a sample here, that is our buttons, or sometimes they can be sliding buttons on your screen. Now, you may not use these all the time, but sometimes you will be adjusting these. If you, say, have a lot of brightness at the front of your screen, darkness at the back because you're losing some of that penetration, you can adjust this to make your image look a lot more even. Lots of times you won't even realize that you're off, and then you see somebody else adjust it for you, and it's kind of like, oh, what was I missing there? So the TGC can be very helpful in evaluating that penetration and the tissue texture all the way through your image. Now, a lot of equipment will have kind of like a cheat button. I think on GE it's called iScan, Philips it's called something else, and it's a button where you can actually tap that button and it will automatically reset your TGC, or TGC, time gain compensation. I have it written incorrectly over here, sorry. It will correct your TGC, set a gain that is most commonly appealing to most people's eyes, things like that. But not all of your equipment, especially the point of care, more basic units, will have that. So it's important that you get comfortable to make the adjustments in case you don't get those extra things. All right, so then we have our focus, and our focus is one of those things that usually you'll see it's a little arrow or something to the right side of your screen. This particular one looks like it's very small, but it's set right here. And you probably remember that the focus is able to optimize your lateral resolution, which is your resolution of items that are located side by side. And so if we want to be able to differentiate two items that are closely arranged together side to side, we need to optimize our lateral resolution. And so by setting our focus, we can enhance that resolution and make anatomy a lot easier to see. So the rule of thumb is usually if you're scanning a whole area, say such as the liver, and you want to look at all of the liver tissue, you just put your focus at the very bottom or the very far field at the back of your screen, say down here. But if you're looking at something, maybe trying to see a common bile duct, or you're trying to do a measurement of a fetal part, something like that, then you would move the focus up to exactly the area that you're looking at. So, and you can see in this instance, the tech probably has their focus set about here, which is just beyond the vessel. Since their focus is the vessel, that's a perfect place to place it. Okay. Now, a lot of equipment will also have harmonics as an option, and harmonics, as we spoke about, is kind of a phenomenon where when the sound goes into the body, it actually produces higher frequencies than what was introduced into the body itself. And so those harmonics are multiples of the operating frequency. The benefit of this is these harmonics can then bring back higher resolution than will be provided than just at the operating frequency alone. So adding harmonics, usually there's just a simple button where you can turn harmonics on and off. Adding those harmonics can be really beneficial in providing extra detail of certain areas. Sometimes, and it can be just completely random, sometimes you'll have harmonics on, it works for 80% of your patients, and then all of a sudden it doesn't work on a patient. You might actually image them better with harmonics off. So know that it's not It's not foolproof, but it can be a great tool if you're struggling. And these harmonics does work very well, especially if you're looking for something like a needle tip, catheter tip, something like that. And then finally, dynamic range. So we haven't really talked about any artifactual principles yet, but artifact occurs a lot on ultrasound, and sometimes you'll see a lot of echoes or information coming from something where there shouldn't be any. So within the fluid-filled gallbladder, within a cyst, within the urinary bladder, within a vessel, things like that. And you'll see a lot of echoes and they're distracting from the image. Sometimes if you adjust your dynamic range, that can get rid of some of those echoes and allow you to see what you're intending to see. This can also work with needle tips and catheter tips as well. Get rid of some of those grays and limit it to a shorter scale of contrast so you see more blacks and whites that allow you to differentiate things more easily. So those are the majority of our B mode adjustments that you'll want to use on an everyday basis. Once you get the grasp the image that you want, you can always hit freeze. It's usually right down in this region, and you can then save an image, usually right next to it. If you have an image that you thought you saw something, but when you freeze it, by the time you freeze the image, you can't really see it anymore. Just by tracking back on the trackball, we call it citying back, you can track it back and you actually get more images as you track back through the memory than you ever saw on the screen in the first place. So sometimes that's a great option if you feel like you just missed something or something's not quite as clear as you'd like it to be, is to go ahead and track back. Just a warning, that gets to be quite the temptation sometimes, where all of a sudden you're imaging and every single image you take you're tracking back, which can eat up a lot of time. But those are some of your options with B mode, and of course if you have any questions, please let me know. When we come out to your individual sites, we can work with you on the equipment that we'll be bringing, but then we can also try to set aside some time to work on any equipment that you may have at the hospital and look at these bells and whistles and how to optimize your image on that equipment that you're going to be using on the everyday basis. Okay, so that was our B mode discussion, but we know a lot of the times you guys are probably going to be looking at color Doppler as well. So we know that color Doppler is going to show any type of motion. Most of the time we're using it to look for vascularity within the body, but sometimes it can be used to see things like jets of urine going into the bladder or urethral jets, because it's going to pick up any kind of motion that it sees. So when you decide that you want to use color Doppler, you need to first find and optimize your image in B mode. Once you've done that, then you want to focus on the particular vessel at hand or interest, and you want to optimize the image of that vessel. And most of the time that might mean bringing up your focus to a smaller area. Maybe you're going to zoom in on the area or magnify, which we can go over with you in your hands-on time. And then it's time to turn your color on. So you have a couple different options. If you know that you're going to be looking at spectral analysis or you want to know the direction of the color flow, then you need to go with color Doppler. If you really don't care about directional flow and you're not going to be assessing velocities of your flow, especially if you're in a very low flow area, such as the testicles, sometimes the cortex of the renals, maybe the thyroid, things like that, and you're not going to get velocities, then you might consider going with power Doppler. It won't show you direction, but it's going to be a lot more sensitive than your color Doppler. So for this instance, we're just going to show that we're just going to talk about mostly using our color Doppler because it's the most complicated. So when you're utilizing your color Doppler, first of all, you're going to have your B mode optimized, find the vessel that you want, and then you hit the button for color Doppler. Now, if you're utilizing a linear probe like the image here on our bottom is, you have the option to steer your color box. And when we say steer your color box, if you'll look at this image, my B mode image is being taken in one direction, and my color box, this box here, is being steered in the opposite direction. Now that allows for the insonation or the sound waves to hit the vessel or the moving blood flow at an angle different than 90 degrees. We cannot, if we are using our ultrasound and hitting the vessel at 90 degrees, most of our sound is being reflected right back off the wall and it's not getting into the vessel to provide us Doppler shifts to then show motion of blood. So it's very important, if you have the ability, especially with your linear probes, which you usually will have, is that you're steering that color box. Now, there's not necessarily a rule about which direction you're steering it. After a lot of practice, you just tend to know which direction to go. And you'll often see that as you steer it from one direction to another, your color scale that you see right over here may follow. So if I were to just steer my color box the other direction, my color map would probably invert and follow me. Now, if I wanted to leave my box here but invert my color map, there would be another control where I could just press invert without steering, and I could make that happen. So just kind of play with your machine, figure out, okay, when I steer, does it change both? Does it change one? Or do I just want to invert just one or the other? Now, if you're scanning with a curvilinear probe, as we are up here on the top image, you will see here's my curvilinear, and there is no ability to steer a curvilinear box. So that's not going to be an option with your curvilinear. So in this image of the portal vein here, you see that you're somewhat limited. Where my scan lines are coming out on this side of the curvilinear probe, you can see that blood flow is moving toward that part of the probe. Now where these are going this direction with this curvilinear, that blood flow is moving away. So you see part of the vessel in red, part of the vessel in blue, and that's simply because this is a curvilinear, not that the blood flow is turbulent or reversing or anything like that. So that's just one of those options that you don't have on a curvilinear, so don't let it alarm you when you can't see, when things look different. Okay, now once you have put your color flow on, if you're happy with the color flow, that's fantastic. But one of the things we talked about, like with our gain, is that it is actually recommended with the color flow, like with gain, that you turn that color up as high as it'll go, and it'll have a lot of artifactual flashing of color on your image. And then you want to back that color flow off with your color gain until you see all artifact gone, and then but you maintain all of your real information, like here in this carotid. That's the best way to ensure that you have maximum sensitivity of your color. If you have it turned too low, you may miss something that you otherwise would have liked to have seen. If you have it turned too high, you might get so much flashing that it's distracting and you miss something. So that's an essential part of getting your color flow set properly. And the other thing is if in here with our curvilinear transducer, it's pretty normal, like I said, just because the scan lines are divergent, it's pretty normal that we'll see one vessel in red and blue. Now, most of our vessels, like in this carotid, say, it would be pretty uncommon for my common carotid to have flow going in multiple directions. Now, if it's post-stenotic turbulence, then of course that would be reasonable. But if it's not turbulent, I shouldn't have color flow represented as blue and red. And if you're seeing that, that's going to be a problem with your scale. So you would want to increase your scale, because what's happening is the flows that you're seeing in a blue area would be beyond the velocity of the flow that you have your scale set at. So what it does is when you go beyond that flow, it wraps around and starts demonstrating the color as at the opposite end of the scale. So if you're seeing that aliasing, just increase your color scale and that should resolve it for you. If you increase your color scale too much, you'll start losing sensitivity and you won't be able to fill your vessel. So it's kind of a fine balance where you need it high enough but not so high that you aren't able to see your vessel anymore. So that's going to kind of direct your scale settings, and you'll find the same thing with your curvilinear that you will with your linear down here. Now, the other thing that you can do in this image, this is a carotid ultrasound, and so we know that we want, if the head end is to the left of our image and the feet are to the right, we want that red artery demonstrated as red. Now, because of how my box is set here, if I had red as a positive Doppler shift or at the top part of my scale, that would indicate that the blood was flowing to or toward my scan lines, which would mean it was actually going this direction. So you see what the technologists did here was they inverted that color scale to make an artery look red, but to ensure that the flow was going the right direction, they can evaluate where their scan lines are going, see that the blood flow would be moving away from the scan line rather than toward, know that that would be a negative Doppler shift and would therefore be represented as red because in this instance, red is demonstrated below the baseline on our color scale. Now, the last thing I wanted to mention when it comes to color, and this may or may not be a huge consideration for you, but lots of times we'll get a lot of flashing in the vessel wall that can be very distracting or maybe confuse you for a pseudoaneurysm or something like that. And so one of the things that can be helpful is that there's something called a wall filter. And so because Doppler, especially color Doppler, detects anything that is motion at all, and we know especially in our arterial system we're going to have pulsatility and not just the blood flow but in the vessel wall itself, it will actually apply blood or color flow to the vessel wall. And so these the amazing manufacturers have developed systems to help reduce that, and those are called wall filter. So if I'm getting a lot of flashing of color in my wall, then I could increase my wall filter, which should help eliminate that. And then one more thought just on the wall filter and the scale here. Another thing that you want to be considerate of is your baseline. So here you see your baseline is right here. If your baseline somehow got shifted from one end to the other, that can affect the color that's going to be demonstrated on your image. So hopefully those are some practical things that you can use in your scanning. Okay, so now we've talked a little bit about optimizing your B mode imaging, then your color flow. And now if you decide that you wanted some velocity or some resistance evaluation of your vessel, then you can add in your spectral Doppler. So with spectral Doppler, you want your B mode optimized, then you want your color mode optimized, and then you can add in your spectral gate. So you would do this by hitting spectral Doppler or spectral analysis on a button on your imaging system, and then that will provide you what we call a range gate or a gate here. And so you would want to then make sure that you get that gate within the center of the vessel, because we know that we'll have a little bit more viscosity and friction at the periphery of the vessel. So by getting it right in the center is going to be our most accurate readings. Once you have that gate centered to the vessel, then you are going to bring up your Doppler angle. It may come up with your gate, or it may be something that you have to hit a Doppler angle button to add. And you can see here this line that you see coming right through the gate here is the Doppler angle. You want to make sure that that Doppler angle is parallel, number one, parallel to the vessel wall. And then number two, you want to make sure that it is reading that it is either 0 degrees or 30 to 60 degrees. And those are going to get you the most accurate velocities of your spectral tracing. And there will typically be a little notation, usually in one of the corners. I believe in this case it's covered up by this this magnified image, but there will usually be a listing of what Doppler angle you're at here. Now, if you're at a degree more than 60 or less than 30, you optimally want to adjust to get it within that range. So you can do that by steering the box. Sometimes we'll still steer the box and the angle together. If that doesn't get you to where you want to go, sometimes you actually have to adjust your hand and tilt up or down to accomplish that parallel angle to the vessel wall while maintaining the appropriate Doppler angle. Now, once you feel like you're happy with your Doppler angle, you can adjust the sample volume, or what we call the range gate. You can make it larger or smaller. Most of the time you want to keep a relatively small range gate, or you'll start to get a lot of artifactual information from maybe slower flow with the wall or something like that. So once all of that is set, then you can go ahead and you can hit update, and that will update your system so that it starts taking the spectral Doppler tracing. And so here you see on this image, we're getting a nice tracing of the velocity of this artery, and we can look at this velocity and we can say, okay, we have a good systolic upstroke, meaning that that blood is being moved forward through the system with ease, without a lot of resistance. And then during diastole, it's the speed of that blood flow is going to taper off, but it never comes to a complete stop because it maintains above the baseline. And then as the hydrostatic pump, or the potential energy of the artery, kind of kicks in and does another little compression, you see forward motion of that blood throughout diastole again. So this would indicate that you have a very low resistance spectral tracing of an artery. If you were to start seeing some reversal here, or a dipping down, where at the end of systole the blood hit baseline, stopped altogether, or that the blood was actually reversed, that would indicate that there was significant resistance up ahead. So this shows a nice low resistance waveform, and so you can do some other adjustments which would optimize your ability to not only see but to measure that waveform. So one of the things that you can see you can adjust here is, if you look at the y-axis over here, we see a listing of velocities. So these are all in centimeters per second, and we have 50, 100, 150. If my velocity was going, say, maxing out at 40, then I would have a lot of blank area up here at the top of my tracing, which wouldn't be doing me any good. So if that's something that's happening to you, make sure that you can adjust. Again, you can adjust your scale of your spectral Doppler to maybe bring it down to 100, or something that is going to fulfill that whole area with information and make any measuring that you're going to do easier. Now, if I were to hit calipers and put a caliper on a tracing, I could take a velocity measurement of an exact velocity of my peak systole here to tell me how fast the blood within that range gate was moving at that moment of time. So it's pretty common for us to be measuring peak systolic velocities and diastolic velocities to kind of help assess. We can do some different ratios and things off of that, but to assess the resistive indexes, or the velocity or ease of flow. Another thing that you may see is an example that you see on the bottom of the screen here. And we talked about how color does an aliasing. If my scale is set to only demonstrate velocities that are slower than the blood is actually going, it will wrap around on the color scale. Well, the same thing happens on our spectral scale. So you can tell that whatever, it looks like we're probably set at 40 centimeters per second up here, down to negative 40 centimeters per second here. And obviously the velocity of this blood flow is going faster than 40 centimeters per second. And so since the scale isn't present to demonstrate that, it wraps around into this aliasing. So to correct something like this, you would want to possibly bring down your baseline, so you can adjust baseline. There will be a button where you can do that. And then if you're still getting aliasing, you would want to increase your scale. So those are a couple of the changes. Now, if you have a really robust system, there might be like an eye scan or a cheat button that would do this for you. But again, not all systems are going to have that, so a lot of times you're going to be having to do this by hand. Okay, so just a few other considerations or techniques, and I've been trying to think, oh, what would be important if, how are the physicians going to be using this? What's going to be most important to them? And I just had a few other suggestions I thought might come in handy. So First of all, if you're looking for needles, catheter tips, doing a lot of that kind of placement or invasive procedures, you're having trouble following your needle, there are things that you can add on to the transducer, which are little plastic needle holders, which will keep the needle aligned with your transducer. And so you see in this image here how you see the needle extended out perfectly in line with your beam. Those can be really helpful if you're not confident in, or you're having difficulty keeping the needle in your field of view. If you feel like you can do it by hand and you're losing the needle, it's usually as simple as just sweeping back and forth to pick it up again. If you're having trouble with your settings and you don't feel like you're seeing the needle as well as you want, make sure that your focus is at the depth of your needle tip. And you might want to try to turn harmonics on and then adjust your gain up and down. Another thing is that will change your contrast is your dynamic range. So we know that the contrast of a needle is going to be, significant compared to the contrast of tissue. So you don't need a lot of shades of gray to demonstrate that. So by turning your dynamic range down, it might actually enhance your ability to see that needle. Now, we go through all the rules of, your Doppler angle and all of these other rules that apply to our spectral analysis. Sometimes as a physician, you probably just want to see if there's blood flow there or not. And so if that's the case, you're not going to be taking any velocity measurements. You don't care about the resistance. You just want to see blood flow present. Then your go-to may just be that power Doppler. And you see that's utilized here in this thyroid. And it's just showing a higher sensitivity to low flow areas. This works fantastic, like I said, in the thyroid, in that cortex of the kidney, in the ovaries. That's huge. But just recognize that you're not seeing velocity of blood flow and you're not seeing direction of blood flow. If numerous adjustments are made and all of a sudden you're really unhappy with your image, one of the best things to do is stop scanning, go select the same transducer that you're using and select your preset again, and it will just start you at it from scratch. So if you've made too many changes, you feel like you messed up your image, you can't get back to where you wanted to be, you don't have to exit the patient, just go reselect that preset. All right, so I hope this was helpful. If there's anything that you all see yourself needing to use and we're not covering, please let us know. And hopefully, in summary, we've determined that optimizing images saves time and frustration and improves efficacy of procedures. And you guys as physicians, if this is not helpful or this is more time consuming than it's worth, it gets really easy to want to give up. And it can be such a beneficial tool. And so by hopefully giving you these little tips and tricks to help it make it a less painful process will be helpful in making you want to continue the use of this. We also want to make sure that you're learning the most common ways to make minor adjustments. And once you really get those practices of making those adjustments in place, over time they will become habit. Just like when you're scanning for anatomy originally it take a lot of thought process. So I need to move my hand here, or your hand and what you expect to show up on the image is not correlating. Over time, fortunately, due to muscle memory, your body learns to do a lot of this stuff without you even concentrating on it. So just by taking that time in the beginning to become very conscious of what you're doing will save you a tremendous amount of time and effort and frustration in the future. So I hope this will be helpful to you. Please let me know again if I can help with anything else, and I hope you have a wonderful week.